Raynaud's phenomenon, Raynaud's disease, Raynaud's syndrome all involve fingers turning white, but the diagnosis is different. So let's clear this once and for all. What happens and why it happens. Raynaud's phenomenon is an umbrella term. It simply means episodic vasospasm of the small arteries secondary to cold or stress. It involves first the fingers turning white because of the vasospasm and ischemia. Then it turns blue because of cyanosis secondary to the deoxygenated blood getting accumulated, and then it turns red because of reperfusion, and this might also involve pain. Raynaud's disease is primary Raynaud's phenomenon. Here there is no underlying disease, it's just functional vasospasm. For example, take a woman 15 to 30 years of age, presents with fingers initially turning white, then blue and then red. She has no ulcers, no gangrene, mild pain and normal pulses. This is mainly due to exaggerated alpha-adrenergic vasoconstriction, but there is no structural vessel wall damage. Very important to remember, Raynaud's disease is a disease of exclusion. Raynaud's syndrome is secondary Raynaud's phenomenon. If Raynaud's disease didn't have an underlying cause, Raynaud's syndrome always has an underlying cause. And these causes can be connective tissue disorders like systemic sclerosis or SLE, vascular disorders like atherosclerosis or Berger's disease, drugs like beta blockers, and occupational in individuals using vibrating tools. So, if an elderly individual presents with severe pain, asymmetrical involvement, ulcers, gangrene and reduced pulses, think structural vessel wall damage, think secondary, think Raynaud's syndrome. So here's the logic made super simple. Raynaud's phenomenon is a clinical vasospastic condition. When it is idiopathic, it is disease. When it is due to an underlying cause, it is syndrome. So basically, phenomenon is the what, disease is when it happens alone, and syndrome when it is due to something else. For more such confusing concepts made easy, follow the surgical mind.